When someone is seeking a tummy tuck, there are a number of questions that I think really are beneficial to ask your surgeon. It gives you more information about the procedure, how it's done, and how it will affect you and the appearance of your abdomen. Number one would be, does the muscle wall need to be repaired? And in most circumstances, if a woman has had children, it will need to be repaired. It does slow the recovery a little bit, particularly in terms of return to exercise, but it's well worth it because it gives the abdomen a flatter overall appearance. Number two is how to do the procedure without making it look unnatural. And I think if you analyze the abdomen in a young, healthy person who's fit, there is a contours present, a differential between one area of the abdomen and another that signifies tone and conditioning. And with doing a tummy tuck, if we don't pay attention to those natural contours, then the abdomen can look very artificial, like a flat board. With the tummy tuck I perform, I do differential thinning of the fat pad so that it accentuates both the semilunar lines along the sides of the abdomen and also the midline structure of the abdomen. And then that's enhanced with the progressive tension sutures that I use as well. And that really will assist in providing a toned abdomen that has differential fat depth and more of a three-dimensional effect for the abdominal wall. You should ask the surgeon about whether or not treatment of the pubic area is going to be included in the abdominoplasty. This is oftentimes forgotten or ignored by some who perform this procedure, and it should not be. The tone of the abdomen and the tone of the so-called mons area or pubic area should be the same. So that often requires lifting of the mons area and or thinning of the mons area so that you don't have a flat abdomen and then fullness of the pubic area. So those should really match, and it's important to deal with that during the procedure. And then finally, another area that can be overlooked is the area along the sides of the abdomen, the so-called love handle area. And I would recommend that patients ask about whether or not contouring in this area is an important element for their treatment as well. It can be overlooked, as I said, and it can result in, if it is overlooked, overall flat, nice looking abdomen, but then fullness along the sides, and those two things don't match. And so I believe that we should always look aesthetically at the entire abdominal hip waist unit together so that we could create harmony between one area and another and create a look that is natural, so that a woman would be proud to put a swimsuit on and not self-conscious going to the pool with their children.